You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how to reset your metabolism. My first guest is a medical doctor, and she believes you can reset your metabolism. Dr. Joy Hamilton. Dr. Hamilton, welcome to the program.
Thank you.
Pleasure to finally meet you.
Yes.
Now, before we get into today's topic, tell us a little bit about your practice. You have a weight loss part of it. Tell me about it.
Yes. I have a practice that specializes in physical medicine and rehabilitation, and a portion of it is weight loss management. We have a protocol that we have our dieters follow, and we've been getting amazing results.
So the results are good.
They're great.
How much weight are they losing, by the way?
Well, we have people losing anywhere from 30 to 70 pounds so far.
Is that right? How many pounds a week?
Men are doing about 5 to 7 a week, and women about 3 to 5.
Okay, now you have an interesting we should talk a little bit about your background and training. Let's start there.
Okay.
Then we'll jump right into your approach and philosophy to weight loss.
Well, undergraduate work I did at University of Pennsylvania, and that's where I first got introduced to nutrition. I did my medical school and residency training at Virginia Commonwealth University Medical College of Virginia, and that's where I specialize in physical medicine and rehabilitation.
So physical medicine, exactly what is that? What does that mean?
Physical medicine and rehabilitation, we're called physiatrists, or for the purest, physiatrists, and we take care of those patients who have had a injury such as either a stroke or heart attacks, who've undergone spine surgery, had amputations, knee replacements, hip replacements, brain injuries, traumatic or otherwise, and we help them function, get back to the
everyday life.
Everyday life, and being as functional as possible. I especially enjoyed brain injury, and for the last 7.5 years, I've been doing spine injuries, cervical, lumbar.
But why the weight loss? I mean, why do you decide to have a weight loss program?
I was seeing a trend in my patients, and as they were having a decrease in their activity, they were having an increase in weight, then there was some depression and changes in their lifestyle, and more depression, more weight gain. They were turning to food for their comfort, and this cycle was starting, and I didn't know how to get them out of it.
Okay.
And as they were having more weight gain, they were having more pain. So I was seeing them more frequently, and it was just this cycle that was happening, and I just said, I have to find a way for them to lose weight.
Okay.
And that would help them decrease their pain.
Do you think you found that way?
I did.
Really?
I did. And you start looking at all these different, you see all these commercials, lose this, lose that. Then like years later or a couple months later, you see that people have gained all the weight back. So I needed to find something that could help them lose their weight, keep it off, and then help them increase their activity and break the cycle of the depression and inactivity. And
really? Okay.
Yeah, and we don't like to call it a diet. It's a protocol, because once you do it, you're done. You don't have to go back and do it again in 6 months or whatever. It really changes the way you have your relationship with food, how you prepare your foods, and how you live your life. And it sticks.
What about cravings, though?
With this program, because it resets your metabolism, it rests your pancreas and allows your pancreas to work the way it's supposed to and secrete insulin the way it's supposed to, you lose those cravings. The cravings come from your blood sugars being all over the place.
Okay.
You have a high blood sugar, a low blood sugar, and people start to eat to fix the blood sugars. So,
interesting.
Right. So when your pancreas is working in overdrive and it secretes way too much insulin, it drops your blood sugar, you have a carb craving.
Okay.
This diet tells your pancreas, act correctly. It resets it back to its normal state. Cravings go away.
And I mean, is that what they tell you? And how soon do they go away? What do they tell you?
My dieters have had their cravings go away in about a week. The first 3 days are hard. Everybody tells you the first 3 days are hard, but kicking a habit of anything, if you stop smoking, if you stop drinking, if you stop doing anything, stop drinking coffee, those first 72 hours are hard.
But isn't it just eat less, exercise more? What do you say to people that say eat less and exercise more?
That's what most doctors will tell you. Don't eat so much, go out and exercise, you lose the weight. It doesn't work that way, because your metabolism your pancreas has been burned out and your metabolism isn't working correctly. And over the years, things happen, particularly to women. Over the years, women gain about 10 pounds every 10 years.
Is that right?
Yes. And women in their mid-40s pop up and say, how did I get to this state? Wasn't I just 25? Didn't I have a fit body? They've had babies, they've had careers, and then all of a sudden they wake up and they're in this body that they don't know. And
did they tell you that?
Yes. Yes, it's amazing. When you sit and actually have a time, I'm fortunate that I do have time to sit and talk with my patients. I don't have to rush through them every 10 minutes. And they will sit and talk to you and let you know, like, how did this happen to me? You know, particularly those who were injured. I was in a car accident, a lot of them say, about 5, 10 years ago. I didn't think much of it, but I'm still hurting. And the reason why they were hurting initially after the accident has healed. It's all the other things, the weight gain, the change in their activity. They're not interacting with their families the same. They've changed their work life. All of these.
It's depressing, by the way, to be overweight. I've been there on some of my old shows. I'm 40 pounds heavier.
And the thing is, sometimes overweight people don't realize that they're depressed.
Really?
I've been finding some of my dieters have come back after they've lost as little as 10 to 15 pounds and said, I didn't realize I was feeling that badly.
Really?
They are coming back and saying, I didn't realize that because I didn't fit into my favorite pair of jeans, I stopped going out with my friends. And because I stopped going out with my friends, I stayed at home and I ate more. And the cycle had started. And so now that we've been able to get them to break that cycle, everybody's having these little aha moments, or their little light bulbs are going off. And one dieter said to me, I didn't realize I thought about food as much as I thought I did. Because now with our protocol, you do have to pay attention not only to your portions, which a lot of people say, just control your portions. You have to actually look at what the food is, what categories it is. A low glycemic food, is it an animal protein, is it a plant protein? How many carbs really are in there, and where do those carbs come from?
So if I had to classify it, or if I had to ask you, you know, is it low calorie? Is it low carb? Is it, you know, what is it?
It's the ideal
low
program.
Fat?
It's the right proportions and high quality protein.
Okay.
Protein is the one thing that people don't do right. They know they're supposed to do it, but picking the correct proteins, the ones that are most highly bioavailable, and then putting in the right amount of fats, the right amount of carbs, so that your metabolism is working efficiently. I became a doctor because I always thought people took better care of their cars than they did their bodies. And I wanted to teach people how to take care of their bodies. And this program has allowed me.
So this is right up your alley.
This is fulfilling my dream.
Now and by the way, I told you this. You know, our program now airs throughout the United States, Canada, and you know, I get a chance to really pick the brains of some top docs and nutritionists. And I said, this sounds good. You know, I'm not trying to endorse you on the program.
I understand.
You know, I haven't met your patients, but it is an amazing twist on anything I've ever heard. And it seems easy. You provide the food. I should mention this, that you also provide a lot of the food.
We provide the proteins.
Okay.
The dieter provides everything else. We just teach them, when you go to the grocery store, this is what you need to buy. And when you prepare your foods, this is how you do it. Some little things like what type of vinegar do you use makes a difference. What type of seasoning you put on your food makes a difference. And lots of times people don't understand that there are calories hidden in things that you didn't know had calories.
Okay. So how is this different than other typical medical weight loss programs, in your opinion?
We have no pills, no shots. We do check on you once a week to make sure that you're doing well. But other than food, that's our only treatment.
But when you go to a medical doctor, you know, and I mean, don't they go to medical doctors for weight loss for the weight loss pill?
Traditionally, yes.
Okay.
I don't believe that. I believe we can accomplish the same things at phentermine or
like phentermine, okay.
phentermine or any of the other pills that you take without pills, because that's a short-term fix. We're talking about the rest of your life. So this protocol, we're going to get you on this protocol that you can live with for the rest of your life. Once your metabolism gets reset.
So you reset the metabolism.
We reset their metabolism. And you know, everybody's a skeptic. So even in doing this and starting with my first couple of dieters, you know, you're waiting with bated breath to see how they get through the protocol. And my first dieters, I was utterly amazed. And the ones who have made it through and are on our maintenance phase are doing fine.
Okay.
They have changed how they view food. They've changed how they prepare their foods. They've changed their food choices, and they feel great. And
how often do they come in?
Once a week.
Once a week.
Once a week, twice a week if you're really, really busy.
Because most dieters, I guess, are professional dieters. I mean, they've tried a few things before they get to you.
Exactly.
What do they say to you? What are their comments on how yours is different, or maybe something that they didn't expect was going to happen that happened?
Our professional dieters compare us to every other program. Oh, you're like, they find out our components that are like other programs, and that's when they first join. After that first week, they say, it's like nothing I've ever done before.
Really?
Yes, because our protocol is special.
It's 4 phases.
It's 4 phases. There are 4 phases. Well, just the different phases, the first 2 phases, we're completely resting your pancreas.